ever stood up and felt lightheaded, you're not alone. Sometimes it's nothing serious, but sometimes it's a sign that something deeper needs medical attention. I'm Dr. Berens, and I'll help you understand when dizziness is expected, when it's concerning, and how to feel better safely. So first I'm going to explain why is this so common? Why do we often feel lightheaded or dizzy when we stand up? So when we change from a lying or sitting position up to a standing position, this is known as orthostatic or postural changes. What's happening there is our blood volume that previously was all kind of on the same level based on gravity. We were all maybe lying flat. Our blood is all kind of pulling along the same level. When we stand up, gravity pulls all that blood volume down. And so our body has to make some adjustments to bring that blood volume back up to the rest of the body, and particularly to the brain. And there's a series of adjustments that your body has to do that. We have to slightly increase your blood pressure, increase your heart rate, and that process can be interfered with by several various medical or environmental conditions, and that can make you feel dizzy or lightheaded because now you're not getting as much blood flow to your brain. So the most common reason that this happens, and something probably most people have experienced, is if it's really hot. So you're outside in the heat. Our body's normal response to that is to dilate our blood vessels to help us release heat back into the environment and cool our bodies down. And so when we do that, we essentially lower our effective blood pressure, because the blood vessels are dilated. And so then if we go from sitting to standing, it's a little bit harder for us to make those adjustments needed to bring the blood flow back up to our brain if all the blood vessels peripherally, like in the outside of your body, are dilated. And so that can mean a slower return of blood flow up to your brain, and then you feel lightheaded or dizzy. So that's super common. It's probably happened to almost everyone. But there's several medical conditions that can contribute to this as well. So for example, if you're dehydrated or if you're anemic, that can mean you have a smaller amount of blood volume, either because there's not enough fluid or there's not enough blood. And that also then will make it harder for us to get that blood volume back to the brain when we make those postural changes. And so that can also cause us to feel lightheaded or dizzy. Another really serious reason that this can happen is malnutrition. So in malnutrition, not only do you have reduced blood volume because there's maybe less protein, less blood, less fluid, you can also be anemic or dehydrated from malnutrition, you also have less strong heart muscle and less strong muscles in other places in your body, and that can also increase the difficulty in making those necessary adjustments when you go from sitting or lying down to standing. There's also sometimes some autonomic nervous system dysfunction. So your autonomic nervous system is the part of your nervous system that's responsible for controlling your heart rate, your blood pressure, all your vital signs. That can be affected by malnutrition as well. So there's a lot of different factors that with malnutrition that can cause this change in position to be a greater effect on lowering our blood pressure. And so really important to understand if any of these things are going on. There's also some more other conditions that can cause autonomic nervous system dysfunction that are not related to malnutrition. For example, there's a condition called POTS, or postural orthostatic tachycardia syndrome, that is still poorly understood, but there's a variety of reasons why that may contribute to this problem. After infections, such as like people with long COVID, can have an impact on their autonomic nervous system, and that can cause them to be more likely to feel dizzy when they stand up. And then there's other disorders that affect the nervous system that can also affect the autonomic nervous system, and that can contribute to this dizziness when we stand as well. So if this is happening to you, it's important to know, is this something that's like a mild reversible thing, or is this something more serious that I actually need to get checked out? So the first thing you should do is look at environmental factors. Like, are you overheated? Are you hot? If you're outside in the heat or your house is hot, get into a cooler area, try to cool yourself down. That will reduce that dilation in your blood vessels and help bring back up your blood pressure and make it easier for you to make those adjustments. It may be that getting out of the heat alone is enough to help. If you were also dehydrated because you were in the heat and sweating a lot, and now you're also dehydrated, you want to make sure you hydrate. So drink plenty of water. Some people will use electrolyte beverages because that's you also lose salt when you sweat a lot. So especially if you've been like out in the heat, like really sweating, like playing sports or doing yard work or something like that, you may want to consider doing an electrolyte drink rather than just water. And see if that reverses it. It could be enough, something where it was just like your normal response to heat or mild dehydration, and getting out of the heat and rehydrating yourself is enough. If it's still happening, consider, have I been eating enough recently? Are you skipping meals? Are you on a diet? Are you doing something that's really manipulated your nutrition that could mean you're maybe actually not getting all of your nutritional needs met? And if that's the case, you really want to make sure that you start eating more consistent, regular, balanced meals, and you may want to engage the help of a dietitian to help you with this. But if there has been like really restrictive dieting, a really big change in your intake or something like that, I would also consider getting a medical evaluation, because there's a lot of medical conditions associated with malnutrition that you would want to get checked out as well. And so if you've done all of these things, you got out of the heat, you hydrated, you've been eating your meals, and you're not feeling better, this is still happening to you, you definitely want to go and see a doctor. Or if this happens really severely to where you actually pass out when you fall, when you feel dizzy, like you actually fall to the floor and pass out, that's very serious, and that needs immediate medical attention. So you need to see a doctor. You need to be thoroughly evaluated, a complete physical exam, lab work, possibly even some cardiac testing depending on what's going on. But it's really important to understand and identify the cause, because there can be, like I said, very mild reversible things causing these symptoms, but it can also be really serious conditions that need to be properly treated to avoid you, again, passing out, hitting your head, getting injured. There's a lot of serious complications that could come from feeling lightheaded or dizzy when you stand up. So I hope this video was helpful. If you found it helpful, please make sure to subscribe for more practical evidence-based health guidance. And if you're in Texas and looking for a primary care doctor, I'd love to support you. You can learn more at vidafamilymed.com. And as always, remember that I'm a doctor, but I may not be your doctor. My videos are meant to be educational, not medical advice. So always check with your own doctor if you have any questions or concerns about your personal health.